Dr. Bojana Jankovic.
And I'm Dr. Teresa Dean.
And we're going to talk to you about breast cancer screening. And here we're going to focus on breast cancer screening for average risk women. And so what does this mean? So these are women who are asymptomatic or have no symptoms of breast cancer or breast lesions, who are 40 years old or over the age of 40, who have no known family history of breast cancer, who have no known genetic predisposition to breast cancer, such as BRCA genes, who have no history of breast cancer or any breast lesions, and also who have no history of any chest irradiation at a young age. So the American Cancer Society tells us that there's no evidence for performing a routine clinical breast exam in the office. And they also tell us in terms of screening mammography that between the ages of 40 to 44, it's really an individual decision and really is up to the patient and the physician to decide whether they would like to start screening at this age. If they do, they should be screened annually. Between the ages of 45 to 54, they do recommend annual mammography screening for breast cancer. And at the age of 55 and above, patients may continue annual screening or decide to do screening every other year. They recommend that the screening continues up until the life expectancy of the person is 10 years. Generally, this is something that we're not very good at estimating, but this is something that should be decided between the physician and the patient, depending on what their other comorbidities might be or other chronic diseases.
And then we come up with another guideline.
Yes.
So the CDC, or the US Preventive Taskforce, has another set of guidelines. Theirs is actually a little bit more simple.
Yes.
And it just says that between the ages of 50 and 74, that an average risk woman should be screened every 2 years. And that women between the ages of 40 and 49, it's an individual decision.
And as you mentioned, it's really important to think about what the reasons are for screening or not screening in some of these age groups where it's open to debate. So really thinking about what are your personal preferences and your core values. And some people, I have to say, some people prefer to do the least screening as possible because it either might cause too much breast discomfort, or it might be a personal preference because the perceived or known risk is very low and they wish to follow the least sort of aggressive guidelines. And for other people, it might be, you know what, I really just want to know it all. I want to make sure that everything looks okay.
So I think one of the important things we need to think about is really when we want to stop screening has to do with when we wouldn't want treatment. Mm-hmm. So the point to screening is to catch something early and treat it. Mm-hmm. So at the point when we would not want to be treated for something, that's a good time to stop screening.
Well, thank you so much for watching, and we hope that you have found this helpful. And please, please talk to your doctor about this and about your individual preferences, about the guidelines, to come up with a plan that's most suitable for you. Thank you.